Welcome to another edition of IAmAAPC, where we learn the journeys and hear the journeys of AAPC members. Today, we have Jessica Miller with us. Jessica, how are you?
I'm doing great. How are you?
I am great. Thank you so much for being with us. Jessica, why don't you, you know the routine, you know what we're doing here. And why don't you just tell us a little bit about yourself, where you're from, where you work now, and what was your path into medical coding?
Okay, so I'm currently in Chattanooga, Tennessee. Been here just about 11 years now. Recently got married to a long-term Chattanoogan who is on the education side, and I'm on the healthcare side. So right now I'm currently working for Ciox Healthcare. I am the Profi Division Manager. So I have all of the Profi clients underneath me and all of those employees.
Wow.
So our division, we're kind of separated off from the facility side. So our VP works really well with us, developing coders. We provide education. I do the Profi segments for the Profi side as well on the roundtables that they hold each month.
So you've been doing this a long time.
I have been. I've been in healthcare 19 and a half years already.
Wow. And before we went live, you mentioned, you were giving me a little taste of your story, and it didn't involve with coding right out of the gate.
It did not. So I actually started in what we call now is the patient service reps. Back in the day, we won't date how old we are, pulling paper charts for doctors as part of a school project. Also answered his phone, took phone messages, started to learn a little bit about the difference between the billing that we were doing out of the office and someone else was coding it at that time. Answered any questions that I could answer and escalate them as needed. Then from there, I actually started working at Medicare in Des Moines, Iowa.
Wow.
And I was one of the people that was on the beneficiary side, but I also helped in the anti-fraud unit for provider enrollment fraud. And that really got me into where I am now. That opened up a huge platform for me. The education side of it for both beneficiaries and for providers. And then more moved into the facility side, not where my heart is, we'll say. I more like the physician side, the one-on-one, the residents, especially that teaching aspect of it. I do a lot of education when I can. A lot of physicians out there don't quite understand everything a coder does. They just think sometimes we're just being mean. And that's not the case. So being able to teach at grand rounds at previous hospitals I've been at and doing that physician one-on-one education has also been a passion of where I'm at now.
Have you ever worked as a pure coder?
I have. I did that for about 5 years, and then slowly got more into the IT side of healthcare and the revenue cycle piece and moved up from there.
Okay. So you are doing this patient service rep position. That's kind of your entry into this world.
Right.
At what point did you discover coding, and how did that evolve from there?
So probably after I graduated with my 2-year degree, I got a 2-year degree from Ultimate Medical Academy out of Florida. I did just strict home healthcare billing. Then I moved into more of the physician side of coding in hospital. I dabbled a little bit in hospital for a couple of years. Like I said earlier, not where my passion was. It was more of that physician side, having that be where it's not as just diagnosis related and PICS and PCS and all that stuff. So I did that for about 5 years before I started moving up.
Okay. And when did you discover AAPC and our certifications?
So that would have been after I'd been coding for about 7.5 years. I did the bad thing. I let my certifications lapse. Don't ever do that, guys. It's the worst thing ever. You have to sit through all those tests again.
Oh, no.
But it was unavoidable at that time. And so I vowed then, I don't care if I ever get out of healthcare, I'm still going to pay for my certifications because I'm not sitting through tests I've already taken. Now I do want to get 5 more certifications.
Wow.
So I'm at 2.5 now. I'm working on hopefully going to get the last ones over the next 2 years.
Okay, so one of those are CPC, is it CPC?
Correct.
And tell me about the others that you currently hold.
The other one is my CGIC,
Okay.
and then I have a CPC-P.
Okay, awesome. I want to touch more into that, but first, like, I just want to peel back the layers of your early career life. So what's interesting to me is that you didn't start in coding, but that was your entry into it, and you coded for many years before being certified. Usually we see someone who has a certification and then they get a job like a patient service rep or anything to get into the office.
Right.
But what was it like having all of that experience that you had, and then studying for preparing for the exam and taking the exam? I'd imagine that helped you quite a bit.
So it did in a way, but it also hurts you in a way. So the tests are more, and this is one thing I tell a lot of my new people that are just getting out of school, it is strictly by the book coding. When you've already have all that information in your head, your payer guidelines and everything, and United Healthcare or Cigna is not going to pay something, that doesn't help you on the test. So in a way, it kind of hurts you a little bit. I also think though that our industry has changed so much. You can't really go into the healthcare field like I did 20 years ago than what you can now, because everyone wants people to be able to hit the ground and running. And that's a disservice in some parts, because you can't get experience if nobody's willing to give it to you. So I think the education, especially with AAPC that's a huge asset to anyone, whether you're seasoned or not. I mean, there's classes I take just because I need to brush up on it.
Yeah.
And so remembering the basics is what's really important when it comes to getting certifications.
Wow. Okay. That's great advice. And what would you recommend to someone who is recently certified, looking for their first position? Our audience, a lot of those who are watching this are those new coders.
So my suggestion would be definitely go to your meetings. Your smaller clinics and hospitals, they're willing to take CPCAs, those that have those programs. Definitely get your foot in the door in any way that you can. Most of my coders who are even friends of mine we started off in medical records. Just getting your foot in the door to get that experience, and then, work from the bottom up, but you can't expect to jump in and be a coder at $30-$40 an hour.
Yeah.
And not everybody can work from home.
Yeah. Yes. So you mentioned meetings. So you're speaking to local chapter meetings.
Yes.
So if you're watching, make that a priority. Get to your local chapter meetings and network, because I would imagine relationships are a huge part of finding your first job.
Yes, I would agree with that. Networking, if you can afford to go to the regional conferences and healthcare and health cons, definitely I've noticed since I've started going to HealthCon, my LinkedIn alone has blown up. So getting out there, and even if it's a group on Facebook, I know AAPC's got several, join in there, introduce yourselves. I'm seeing that more over the last month. I do see a lot more people in the AAPC group saying, hey, I'm new. What advice do you have? And watching all of us jump in there and giving the background and the advice that we've had, especially when they get discouraged if they don't pass that first time, it's huge to not give up.
Yes. And you also mentioned finding any crack in the door to get into the office, into the business side of healthcare. Would you say it's limiting to just look for jobs with coding in the title?
Yes, I would suggest looking at billing as well. A lot of the payers are looking for brand new coders and billers. One way that made me a little bit different now, and it's rounded out my experiences, I've worked on the back end all the way through the front end and vice versa. So having the background of that billing background, that helps you even more. Bulleting that on your resumes is huge. At least from my side, when I see resumes come through or people saying, hey, can you review your resume? they're only putting coding stuff, but then when you get into an interview, they can't answer the basic coding questions.
Okay.
So that tells me they're fresh out of school and they're trying to land a job that they just they're not ready for yet.
Yeah. Yeah. And I don't say this as a sales pitch, but we do have the Practicode program, which it gives new students a taste of what it's like to code real codes or
Right.
real records and things like that. So there are opportunities out there to prepare yourself for that moment when your resume hits Jessica's desk.
Right. Yeah. Practicode, I can say from personal experience, is a huge help. I took that when I went back to go retest him. It helps. Even seasoned people, there's stuff that you're going to forget if you've been doing it for so long. I've got a coder for me that's over 60 years, several that are over 60 years old. They will be the first ones to tell you they're not going to remember everything day in, day out. They go to Practicum, they go and they purchase the study guides.
Yeah.
When they go to get their next certifications. I do the same thing. I just bought 5 at the last HealthCon. I bought 5 study guides,
Wow.
purchased 2 of more courses. And it's just stuff you want to continually learn. Don't pigeonhole yourself into one thing.
Okay, that's one common theme I've seen from coders I've interviewed for my IAmAAPC is that being a coder and working on the revenue cycle side, it requires constant education.
Yes.
So, yeah.
In signing and another helpful tip, and any even just for a regular coder, not even the revenue cycle side, sign up for those bulletins and provider manual updates that you get from the payers. That's going to keep you on top of stuff. AmeriGroup's got a great one. Blue Cross Blue Shield. Sign up for those monthly bulletins that come out because that's going to help you know a change is coming up. Get that information out to your practices, your providers. And you'll know those things are coming up, and it's going to help you be a more well-rounded coder as well.
Yes, yes. Well, one thing I found interesting in your story so far, Jessica, is your experience with CMS. And I know veteran coders will know exactly who CMS is, and but there might be some new students not understanding the importance of CMS. Would you kind of give us a little overview of CMS, what their role is? And I'm curious, how has working at CMS helped you as a professional, healthcare professional now?
So CMS is the Center for Medicare and Medicaid Services. It is the largest of all the Medicare federal government payers. They make our lives easier or harder. Just depends on their mood, I think. I love Medicare, I do, but when telehealth was huge during COVID, I mean, every day they make the changes. A lot of your federal payers are going to follow their guidelines. Sometimes they're different from commercial, sometimes they're not. The 2 years I worked for them, part of me wishes I would have stayed with them because I loved the anti-fraud unit with them. But on the same side of it, it gave me just enough to confirm that's where I wanted to be, was the education side, the pro fee side of that, being more involved with those physicians rather than the hospital side. They're a great group to work with. If you get an opportunity to work with a RAC or a Medicare fiscal, my suggestion is take it. It's a great position to have. You learn so much there. It's unreal. It can really help you catapult yourself into being an industry leader.
Wow. All right, that's good to know. And is it difficult to get hired on at CMS? I'd imagine there is a big organization.
It's a huge organization. Back when I was doing it about 10 years ago, I mean, I had to go through a federal background check, a state background check. One of the temp agencies where I was going to college was looking for people that wanted to get into it. So I had to go through a very rigorous set of interviews. I'm not sure what their process is now, but I'm sure they're still running all the background checks and all that stuff.
Yes, yes. And for those who don't know, CMS is behind the ICD-10 CMS and PCS code sets. Not only do they manage that, they give us the updates. They manage all of that.
And they work closely with the AMA as well with CPT editorial panels. I know a couple of mentors I have are on that panel. So they do have a lot more say than your CDC or even your Cignas or your Blue Cross Blue Shields, but they really are the gold set standard.
Okay. All right. Well, you mentioned that you have your eye on some future credentials. What are you looking at? What path do you see your career going?
So I'm looking more for my educational ones. I do want to get my CPC-I. That's my main focus over the next year. So I'm going to do both the E&M external audit or the E&M auditor one.
Okay.
The CPMA is my next one as well. And then also I'm looking for my specialty in pediatrics. Have my gastro, but now I'm getting more into being an industry person for pediatrics. I've done some articles with what used to be Supercoder. I have a contact there, and so I've been helping him write a lot of articles on the pediatric side. So I want to start working on getting that as well.
Yes. All right. Well, you brought up Supercoder. So we Supercoder and oh darn, I can't even remember what our AAPC product was called.
Codify.
It's now Codify, but prior to that, Codify is a pretty new name.
Yeah. Oh, what was it?
Oh, darn it. Well, it's slipping me, but basically Supercoder and the AAPC product merged and became Codify. And is that a product that you use?
Yes. So I do purchase that. Anyone that works for me, we do purchase that for our profi coders. And it's a huge help. There's a few of us that are able to pull newsletters that come down. So we share those with our teammates when we need to. It's so much easier, I think, than other encoders that are out there. I actually just filled out the survey that just came for the feedback one. I did the webinar for that. I would recommend it over some other ones. There's one negative to it versus another one that's out there is we can't run commercial edits against it like another larger one. But that would be the only drawback that I've seen so far, but at least helps you with your federal payers.
Okay. And so as a coding professional, there are all these tools. I primarily, when you come into the industry, you just see these code books, which are huge and weigh a ton. And the thought of lugging those around is daunting. Does your encoder tool Codify, does that replace books?
It depends on the coder. I'm personally one that I have to have books and my encoder. Codify has the electronic version on stuff. But if you walked into my office right now, you would see 7 books already opened and spread out across my desk. So I've got that in addition to my encoder on my other screen, just because sometimes it's easier just to flip open a book.
Okay. All right. So what's the mentality, Jessica? Is it efficiency? I guess for your staff, is it just trying to code as many records as possible? How do you guys operate at your facility?
So it depends. In regards to Codify, it's definitely so it goes out clean. You don't want to have to go back and pay someone to. We're in production coding, so the biggest thing is I don't want to go back and pay you to code something you coded on Monday because you messed it up.
Okay.
So definitely watching that, checking modifier usage. I know a lot of my coders use it for their MUEs. They cannot keep track of MUEs on a daily basis, which one, how many has what, or their CCI edits. So it's a good catch for them to use that. So they're more proficient in their coding.
All right. All right. Well, Jessica, if someone came to you, and I'm sure this happens even now, and says, hey, coding is interesting to me. I'm thinking about getting into it. What would you tell them?
I would definitely tell them do it. Start at the bottom if you have to. Don't get discouraged. We see that a lot on the website. I applied for 17 jobs. I didn't get any of them. Go back, and if you have an opportunity, ask those people, what could I do differently, or what experience am I missing? Just recently, in the last 2 weeks, I've had a lot of people reach out and just say, here's what I have for a background. My resume doesn't seem to be getting picked up by anybody. What am I doing wrong? And it was just as simple how they were wording stuff on their resume. Don't give up. You're going to have good days and bad days. Management I'm a little bit different than some managers. I get in there right with my coders and help when they're needed to. If they've got questions, I'm available 24/7, whether it's I've got a coding question or, hey, I'm kind of thinking about going this route with my career. What do you suggest? Networking is huge. They can help you, like you said earlier, Alex was a perfect point. They may not be able to help you today, but in a year they could. And that's very helpful to know and keep in touch with those people. So it's genuine. You're not coming back to them a year later and say, "Oh, do you have a job for me?"
Well, you mentioned mentors, and you not only for staff, because I feel like when you tell me your role, you're really looking at your role as a mentor role and helping and being
Right.
in the weeds with your staff. But you also mentioned that you, as experienced as you are, still have your own mentors that you look
Correct.
up to.
And I have to. I know I'm not perfect by any means. I have personal goals. I would love to be the vice president of Profi Coding one day, whether it's with SciOx or another one. But I know to get there, there's things I need to improve on as well. I'm fortunate enough that my VP I report to is wonderful. I meet with them one-on-one once a week. We go through stuff. Here's what I can improve on, or hey, what are your thoughts on this? And it's a good feedback to learn. Sometimes it's critical and sometimes it's harsh and you can't get down on yourself.
Mhm.
Sometimes easier said than done, but even as someone with my background, you're still going to need to improve. No one knows every last thing as much as we want.
Mhm.
I will be the first to admit I am not a fan of cardio. I still to this day have to reach out to my coders with 1 or 2 years experience and say, teach me, because I just have never put enough time into learning that. An ortho trauma case or a complex GI case, such as a poem, I've got you. So you're always going to grow in your position and never just say, if you have aspirations to be more than just a coder, go for it. Shoot for the stars,
Yeah.
mentor, grow, continue to learn. It's okay if you just want to be a coder, or a biller or a follow-up denials person. But if you want to be more, you've got to continually learn it and take advantage of those opportunities to learn.
Yes, I love that you're humble enough to know and secure enough in who you are and your expertise and experience to be okay with having a new coder who may have been coding cardiovascular more, but they can show you things that you don't know.
Right. I actually went to one of my coders today and I said, I don't get this. I need to bounce this off of you. So, and a lot of my coders still do. I've got one of them that's over 60. She'll say, I'm just not sure about this CPT code. And she'll send it to my work queue to take a look at. And that's what you have to do. You both learn from seeing each other and having that role of what I'm in now for management is, here's how I'm looking at it, how you're looking at it. Let's meet in the middle and see where we can kind of compromise. And sometimes coders just feel like they just need to bounce it off somebody.
Yes, yes. Well, just speaking to mentors and those watching may be thinking, where do I even start finding a mentor, especially if you're not working in the field? But we mentioned local chapter meetings, and you will find a wide spectrum of expertise at your local chapter meetings. The Facebook group, which you mentioned, Jessica, that has again, I think there are 40,000 members in there,
Right.
students to yourself. But we also have a mentorship program. If you Google AAPC mentorship program, you'll find that, and that's a free service to members. And through the program, we connect you with someone who can just be an ear and a support to help you through your career.
It's a
Well,
great program too, Alex. Whoever developed that, great idea,
yeah,
because not everybody uses Facebook anymore. And some
true.
people are more into TikTok and all that stuff. But there really is a lot of outlets. And that's one thing I love about our organization is use it. We pay dues every month for a reason, or every year for a reason. Go out there. That's supporting us, and take full advantage of everything we have to offer.
Yes, yes. Well, Jessica, we have some students who take the exam the first time, pass it, they're done. And then we have students who take it one or and may not pass it on that first try and get frustrated, and maybe even 2 or 3 times and get frustrated. Do you have any advice for those who feel like they want the career to work out so bad, but maybe they feel like they're struggling to pass that exam?
So my way that I did it may not be traditional, but it worked for me. I did my study guide. I did my chapter, read my guidelines and everything. I walked in there the very first time I took it and went in what I called blind. I didn't focus on more than one area than another. I went just by what I'd worked with my study guide and taking all the practice tests. Then once I got my exam results back, I'm humble enough to say I flunked it the first time. I got a 69. And just so you guys know, that's
so
by
close.
1 point.
Oh, yeah, so close.
That's when you go, oh. But then I used those results to see where I needed to focus. So I wasn't over studying in the areas I knew well. I had to go and focus on the areas I wasn't doing as good on. And then I actually joined one of the AAPC groups and found somebody to kind of answer my questions where my stumbling blocks were.
Okay.
There's a whole bunch. If you just Google, there's videos. E&M University was a huge help to me. And that's where I was sticking, was on the MDM pieces of that. And then I went in the second time and passed.
Okay. Yeah. Don't think that just sitting at home, reading and rereading the books and suffering yourself is going to get it. I mean, there are so many resources online, so many great individuals answering questions and tutorials and everything to help you out.
Well, and definitely don't second guess yourself. If you go with the first answer, 90% of the time it's that first answer. You go back and change it. My mom and I used my testing opportunities as mini road trips for us. When I got my gastro, when I passed the first time, and I went, well, there went my next road trip. So, I mean, you can make them a fun event. And I don't test well. I don't. I know I never have. I know my stuff, but I do a lot of what first-time coders do. We overguess and we second guess and change it 15 times and think, well, I didn't take the whole time, so I did bad. Just believe in your own self before you go in, and never second, and taking advantage of all the opportunities we have is a huge help as well.
Awesome. What great advice. Thanks so much for sharing that. And hopefully that encourages someone out there who's watching this today. Any final words as we wrap it up, Jessica?
So final words I'd have, if you're new to this, it's a great program to be part of. Definitely learning as you go. You're never going to be bored. It's not the same thing day in, day out. So variety is the spice here. And if anyone needs help with anything, they're more than welcome to reach out to me.
Great. All right. You can find Jessica in the Facebook group. She's there. I'm sure you could hunt her down online. But thank you so much for sharing your story with AAPC members, Jessica. Just a reminder to all those watching, if you are watching, you are likely on YouTube or one of our social media channels. Subscribe to our podcast so you can listen to these interviews. Just search for the AAPC Podcast on Stitcher, on the Apple Podcast store or the Google Podcast store. And you can find us there, or if you're listening to us, check us out. You can see Jessica tell her story and see her face and hear it right from her mouth. All right. Well, Jessica, thank you so much. And AAPC members, we will see you next time. Thank you.
Thank you, Alex. I enjoyed the meeting.